Hello, I'm Valerie White, Director of Public Health at NHS Dumfries and Galloway. I'm sure many of you will be very aware of the steep rise in COVID-19 cases that we have seen over recent days. In many ways, this is not surprising given the relaxation of restrictions that we have seen. But this rise has been pretty steep, and there are now cases right across Dumfries and Galloway, which does mean people are at increased risk of catching COVID-19 or becoming a contact of a case of COVID-19. Now, we have had a really successful vaccination programme, and vaccination is really very protective at preventing hospitalisation and also deaths from COVID-19. So the vaccination programme has been an absolute game changer. But when we do have really high rates of COVID-19, very sadly, we will still see some people having to go into hospital and requiring hospital treatment. Also, there are impacts yourself of catching COVID-19 in terms of you still need to self-isolate if you test positive for 10 days. And if you're a contact of a case, if you're an adult, you are only exempt from self-isolation if you are double vaccinated and have a negative PCR test. So by the time it takes to work through that, there still is impacts for individuals as well. And you can see at high case rates how that can have quite significant impacts for individuals and also for our services and businesses right across the region. We've seen the very welcome return of schools this week in Dumfries and Galloway, which is fantastic for our children and young people who have had so much disruption over the last year to their education. And again, that's another reason why it's really helpful to keep these case rates down, because we want to limit the impact that our children and young people will have in terms of disruption to their education. So I have asked many things of you all over the last 20 months, and I know I feel like I keep coming back and asking for more. What I would say is that we are in slightly uncertain times at the moment, as we sort of are in a transition phase of living with COVID, and we do need to remember the things that can protect us and keep us safe and stop COVID from having significant impacts on our society. So how we can do that is by very simple things. Vaccination, please, if you have not taken up your offer for vaccination, please do so. At high case rates, if you are not vaccinated, then you are vulnerable to the effects of COVID-19. So please do come forward for vaccination. It's not too late. We still have a number of drop-in clinics and a local helpline number that can arrange vaccination for you. So please do take up that offer, and critically important, your second dose, which does give you that extra preventive benefit as well. So please, vaccination, absolutely key. But the basics as well, your hand hygiene, washing your hands, keeping your hands clean, catching your coughs and sneezes, wearing masks or face coverings and enclosed spaces as well also really helps to protect others. If you do develop symptoms of COVID-19, you still must self-isolate and book a PCR test, and then please do follow the advice of Test and Protect when they are in touch with you. Similarly, if you're identified as a close contact by Test and Protect, please do follow the advice and guidance that they give you in relation to that. Also, in terms of when we're meeting up with people, be thoughtful about the number of people that you are meeting up with and you are having that sort of close contact with. I still like to try and keep 2 meters distance between me and people that I meet up with wherever possible, because that reduces risk of transmission of the virus and it reduces the risk of becoming a close contact as well. Asymptomatic testing is also something that we can do, because that helps pick up cases at an early stage and helps prevent that onward transmission. So that's another thing that we can all do to help keep each other safe and keep case rates down. Meeting up outdoors is also much safer than meeting up in indoor spaces, and if you do have to meet up indoors, please try and increase the ventilation as much as you can by opening doors and windows. So there's lots of little things that we can all still do to try and minimise the rates of COVID-19 while still going about our daily lives. So together we can help to keep us all together and limit the impacts that COVID-19 can have on our region and on our society. Thank you.